A few months ago, a friend sought my advice on how to prevent altitude sickness because she is going to trek at Mount Kailash later this year. I promised to create a video that teaches her a simple breathing exercise on how to prevent altitude sickness. While making this video, I thought, why don't I make it as a public video so that more people can benefit from it? I've been to the Himalaya a few times and even trekked Mount Kailash. The highest point on the trek is 5,600 meters. I didn't have any problem with high altitude because from my Qigong practice, I have already achieved embryonic breathing. But it is not practical to practice embryonic breathing just to prevent altitude sickness because it may take many years to achieve. The good news is there is a very simple exercise you can do to prevent altitude sickness. 2 years ago, I was in India for my personal retreat, and I met a yogi who had lived in the Himalaya. Every year, he brings his follower to Mount Kailash as pilgrimage. And he told me that none of them has any problem with high altitude. I asked, what is the secret? And then he showed me a simple breathing exercise that he claimed could prevent altitude sickness. His followers usually start practicing this 2 months before their pilgrimage. Honestly, I don't know how well it works in preventing altitude sickness because I don't have this problem to begin with. But from practicing this exercise, I find it is very good in promoting qi circulation in the brain, and it could also cleanse some blockages in the brain. So if you feel a little bit sluggish during the day, you may practice this breathing for just a few minutes. And for those who faint easily, maybe because of low blood pressure, this exercise could also help. The yogi claims it could even help dementia and autism. Anyway, try this and let me know how well it works. Okay, first in this exercise, you should be using normal abdominal breathing. It means when you breathe in, expand your lower abdomen, breathe out, contract. Inhale should be longer than exhale. Use about 3 seconds. Inhale to your maximum capacity and use about 2 seconds to completely exhale. Throughout this breathing exercise, you should keep your eyeballs rolled up toward your third eye like this. Now about the movements. Hands should go up, touch the base of your neck, the elbows pointing up, and the arms should touch your ears. Feet should be a little bit narrower than shoulder width. When you breathe in, go up, lift your heels. When you breathe out, come down. You should be breathing in and out with your nose. Inhale, exhale. In, out, in, out, in, out, in, out. Remember to keep your eyes rolled up toward your third eye. In, out, in, out, in, out. One inhale, one exhale count as one time. The yogi said if you can do 200 times without any breaks in between, then you should have no problem with altitude sickness. But if this is the first time you practice this, I doubt you can do 200 times in a row. I would recommend you to follow the Tao principle. Start things slowly and then gradually build it up. Don't force yourself to go over the limit. Start with say 30 times in the first try, and then every day add 3 more times. If you feel dizzy or any discomfort during this exercise, then just sit down and take a rest. Know your body's limit, don't overdo it.